Hi, everyone, and welcome to the Farm Animal Rotation. If you're watching this video, I'm assuming that you're starting the Farm Animal Rotation next week. If you're not, there's probably more productive things that you can do with your time than watch this video, but you're welcome to nonetheless. You should have received in an email from me a kind of a welcome packet that consists of this PDF, which is a detailed explanation of what I'm going to cover mostly in this video today. So if you'd rather just kind of go through that and you're better at learning via reading than watching a video, feel free to just look at that, because this should have pretty much everything that I'm going to talk about in this video, which hopefully will skim the surface and hit some of the highlights. When you look at this video, if you open the bookmarks, if it's not already open, you should be able to jump to different sections that you may be most interested in at the time. So this hopefully will provide a quick reference for you as well. In addition to this PDF, you should have also received a rotation schedule, an on-call schedule, whatever you want to call it. But this document has a few important features, and so hopefully you have it and you can follow along. First of all, you will see that you have been assigned to one of 4 groups in the Farm Animal Rotation. So we like to have you paired up and work in teams. I think this is great for building teamwork, and it also, there's a safety component to it, especially when you're working around large animals. And with the knowledge that many of you in the class are not super familiar with large animals other than what you've already had in vet school, this gives you an opportunity to kind of bounce ideas off of other people, have another person that can just help you work with these animals throughout the course of the rotation. And of course, if you are a large animal oriented person and you have a lot of experience working with these animals, hopefully this is an opportunity that you can help some fellow classmates out. So you are working in groups, and as we see patients in the next 2 weeks, you will be seeing them with your partner or partners. Sometimes there's a minimum of 2, sometimes 3 people in a group. And I hope that as you go through the rotation, you kind of see these cases as your group's case. Try not to either feel overly possessive of a case or say, oh, that's my partner's case, I don't have anything to do with it, because it really is your group's case to work on together. And having said that, I would also encourage you to learn something about other people's cases and other groups' cases. And we will discuss these daily at rounds, but your learning will certainly be enhanced if you don't just work in your own little bubble within your group, but try to learn from other cases in the rotation at large. On this schedule as well, you will also see dates that you are assigned to be receiver, and we'll talk a little bit about what that means later on in this presentation. And more importantly, you will see dates that you are assigned to on-call duty. And hopefully you will have around 3 to 4 dates that you've been assigned to be on call, either weekdays. The weekend dates I've highlighted in this schedule in red. And we try to have a very transparent assigning of these groups or in these emergency days. It doesn't always come out to be fair, and certainly there are some groups that will have more emergency weekend days than other groups, but we really can't predict the caseload. We can't predict what will come in on any one given evening or weekend. And so really in the end, it usually works out to be pretty similar and fairly equitably distributed among the groups. Certainly feel free if there are issues, and we try to, if I know of issues going into the rotation, I try to make the schedule accordingly and kind of adjust things around a little bit if I am aware of known absences. Sometimes I cannot accommodate all of those and still have the transparent making of the schedule. And so sometimes you will have conflicts. And again, we try to minimize those when we create the schedule. But if there are conflicts, certainly feel free to trade amongst yourselves and try to do that in a way that is going to be fair for everyone in the group. So with that, I am going to jump back into the slideshow, and we'll talk a little bit about the rotation. So as with most of the clinical rotations, this is an opportunity for you to apply in a sort of a real clinical setting what you've been learning in the last few years of veterinary school. And so obviously this one is the rotation along with Marysville and some of the PrevMed rotation that we will concentrate on the farm animal species. So you're going to learn about history taking, physical examination, making a diagnosis, prognosticating things, and give you an opportunity to apply that in a real situation. In farm animals, we frequently have a bigger emphasis on economic considerations and making a profit for our clients. Certainly food safety is a huge concern, along with judicious use of pharmaceuticals that sort of intertwines with food safety and drug resistance, et cetera. This, as with many of the rotations, is a practice to, or is a opportunity to practice good veterinary medical ethics, client communication, along with sometimes referring veterinarian communication amongst your team and amongst your rotation at large is certainly important components to the rotation, and an opportunity for you to practice and hone some of those skills. Oops, sorry about that. Attendance is required, and this shouldn't be anything novel to this rotation. If you need to miss a day for whatever reason, there is a mechanism for doing that. You should be familiar with the online absence request form through PPS. We ask that if you know about these absences as soon as possible, please let us know and fill out those forms. If I know that, again, if I know absences are going to happen within the rotation before I make that schedule, I try to adjust things accordingly. Sometimes I can't accommodate all the requests on the initial making of the schedule, but again, realize that you can trade those dates, and usually there is never a problem. There are a set number of days that you can miss. I believe that this is pretty standard across clinical rotations, but we do permit 2 absences within the rotation. We hope that you don't need to use those, or you don't want to use those during the rotation, because it will adversely affect the workload that's placed on the remaining people in the rotation. And I think that it will adversely affect your learning in the rotation. So try to be here whenever possible, but we realize things happen and there are life events that you must miss. And if you miss less than 2 days during the rotation, you should not have to make those up. We essentially have 8 to 5 working hours, with the exception of the emergency, and we're going to talk a little bit about that later. Try to arrive by 8 o'clock during the rotation. If you have a lot of cases that are in the hospital that are going to require a lot of treatments and management, then you may have to get here earlier, and that will be on a day-by-day basis, depending on how many things that you have in the hospital and how intense those treatments are. is going to really dictate how soon you need to arrive. We round daily at 9 o'clock, and by rounds we expect that you have your SOAPs written, your medical records updated, and that's especially important. I will just mention that now, especially important if you have animals going to surgery, because anesthesia oftentimes looks at those medical records while we're in rounds at that time, and so we need to make sure that those are updated. So really all of your work on your patients, so with your physical exams, your treatments, morning treatments, so that is, and your medical records needs to be updated by rounds. And so for the sort of the average caseload, we think that you probably should be here at least by 8 o'clock in the morning, maybe earlier if things need to be done. And on Saturdays, we also round at 9, with the exception of football Saturdays. Oftentimes, if there's noon football games, because of the hectic nature of getting in and out of the school, we oftentimes will have rounds earlier on football Saturdays, but expect rounds on the weekends, Saturdays and Sundays, to occur at 9 as well. We oftentimes are a bit more flexible on the weekends as far as the number of students that we have come in, and we try to get out earlier on Saturdays, because we operate on emergency only basis on both Saturdays and Sundays. But expect that you will have, if you have inpatients, you will have responsibilities on Saturdays as well. And at least on Sundays, we need one person from each group to come in and provide treatments to your hospitalized patients, and to make sure that things are taken care of in the clinic. But feel free, especially on Sundays, to kind of divvy up the work. Please be respectful of your partners and the other rotation mates. And if you know that that the hospital is really busy, that there's a lot of inpatients, it would certainly be appreciated if more people came in to equitably divide up the workload in the hospital. At the end of the rotation, please make sure that as we get ready to transfer these cases that are in the hospital to another group, all your medical records are updated. That includes surgery reports, that includes SOAPs, that includes all your client communication documented, and make sure your medications for those patients are in an area where the next group can easily find them. It is your responsibility to make sure those treatments are done the morning before you leave to go to the next rotation. You are and you will have emergency duty on the rotation. There are certainly slower times of year where there are less emergencies. During our spring season, late winter, spring season, we see a lot of dystocias, and those tend to be that tends to be a busier time of year. But do expect that you will have some emergency cases that you will see. We run a 24/7 emergency clinic. And so we will see patients potentially at all times of the day, 7 days a week. Your emergency on call is done by group. And so when the group is on call, both members or all 3 members of the group are expected to come in. If you do have a conflict, and as I mentioned before, trading is certainly appropriate, please do it in a fair manner. It is perfectly fine, and usually this is the way that it happens, that one member of the group will trade with one member of another group. The entire group does not have to change their emergency on call. Certainly they can if they want, but usually it's a single member that changes, basically changes a group for a night. This needs to be clearly indicated to the front desk when these trades are made. And we can talk to you a little bit more in detail about that and the mechanism for doing that, on the rotation when you show up for the first day. But please, please, please make sure that the front desk is made aware of these changes so they know who to call in when there is an emergency. Our emergency hours essentially are after hours around 5 p.m. to 8 a.m. the next day. Because most of the cases that we see in the hospital are not simple cases that get worked up in 10 minutes and sent out the door or triage and put in a stall. Usually we say cases that come in about after 3:30, 4 p.m. Oftentimes the emergency group who is assigned to be on call that night will usually take those emergency cases. And so we usually say somewhere 4 p.m. on weekdays, we can kind of consider those emergency hours, because chances are you're going to be there after hours if a case comes in at that time. On the weekends, the group that's on call for emergency will be on call from 8 a.m. on Saturday to 8 a.m. Sunday, and the group that's assigned to be on call on Sunday will be on call from 8 a.m. on Sunday to 8 a.m. Monday morning when the new day starts. And so the weekends, emergency duty has longer working hours than does the weekday emergency. So the way that you are evaluated in the rotation is with these three methods. The big sort of evaluation is what we call the ITER, or the in-training evaluation report. And this is very similar. Actually, all three of these are very similar to what's done in other rotations throughout the veterinary medical center. And this should be very familiar with you, especially if you are in later rotations in the year. This is a pass-fail rotation, or a satisfactory, unsatisfactory rotation. And if you put forth an effort and you try, you're going to get a satisfactory mark in the rotation. And so please do that. We want this to be a learning experience for you. We will make comments on your ITERs through 145, and these comments are hopefully designed to be constructive in nature and help make you a better clinician. And please see them that way. Realize that you will work with multiple clinicians during the course of the rotation, and we may not all have, and almost assuredly, we will not all have equal contact with you during the rotation. There are certainly going to be some clinicians that can give you more detail in these ITERs and provide better feedback than other clinicians that may only work with you during a single surgical procedure or something like that during the rotation. And that's frequently the boat that I'm in. And I oftentimes will, scrub in with you and a resident during a surgical procedure. And I may not have a lot of intimate contact during the, probably shouldn't use that word, not a lot of time with you during the rest of the rotation to provide a lot of detailed feedback about management of a specific case, or the way that you put a catheter in, for example. And so realize that your comments are going to be a reflection of all of those clinicians' experience with you during the rotation. Just because you may have received a comment that you may kind of look at that and be like, wow, I didn't really think that represented how I performed during the rotation. It may not. It may just been a one thing that one person remembered, and try to use it as a constructive, in a constructive manner. But don't lose heart, and certainly we want you kind of realize that we're taking the time to give you this comments because we want to make you stronger, want to make you better clinicians. You also have EPAs that you need to do throughout the rotation. I'll be honest with you, I don't see a lot of these and get the opportunity to do a lot of these EPAs. Usually they're the house officers or the technicians. There's also clinical competencies that you need to get signed off, similar to other rotations as well. And you guys know more about them than I do as far as the mechanisms with getting those done. There is a dress code, and the main sort of overriding thing with the dress code is that we want you to be safe. We want to not spread communicable diseases, so biosecurity, and we want you to look professional. And that is the big things with the dress code. So will ask you to wear scrubs and or coveralls during the course of the rotation. I feel scrubs are perfectly fine, especially in the hotter months of the year where wearing scrubs and then a pair of coveralls over top of it gets really, really swelteringly hot in the barn. But we want you to look professional, and so please avoid street clothes. We recommend no tennis shoes and things that you can't adequately disinfect between one stall and another. And so we will ask you, especially if you're working with animals that have diseases that potentially are transferable to other animals or potentially zoonotic diseases, that you use foot baths, that you scrub your feet scrub your boots after you leave a stall before we go into another one. And it's also recommended that you have a change of clothes. So if clothes get soiled during the course of the day, that you can change and you have an extra set of scrubs, an extra set of coveralls, that you can hopefully, again, present that professional appearance especially to our clients, and to minimize the spread of diseases from animal to animal. And this is, I think, pretty standard, the navy blue coveralls for students. Please do wear your hospital ID and your name tags, especially as we're getting to know you. And again, footwear that can be adequately disinfected. Every day, including the weekends, except potentially football Saturdays, we will have ward rounds daily at 9 a.m. On the first day of the rotation, the clinicians that are working on the cases will present the cases that we have in the hospital to you. And from there on out, for the rest of the rotation, it is the student's responsibility to present those cases to everyone else in the rotation, including us. A couple tips with ward rounds, and this is different a little bit than other rotations that you may have had rounds on in the hospital, in that it is loud in the barn. And even when there's not any talking and it is just hardly anything going on, there is a lot of ambient noise in the barn. It's a large open space, and sometimes it is really difficult. In fact, most of the time, it is really difficult to hear people speak. And so please face the audience. And it's I guess a habit that people like to gravitate and look towards the patient while they're talking about the patient. Try to refrain from doing that. We used to say the patient knows who they are, and they don't need to listen to rounds. So please face the audience and project your voice. Speak loudly, as loud as possible. Use your outdoor voices if you have one. The other thing with rounds is relax and tell us the story about your case. We want to know. And yes, it is a time that we are going to use for educational purposes. We want everyone to learn. We're probably going to ask some questions about it. Don't worry about not knowing all of the answers. In fact, I oftentimes don't know all of the answers to the questions that other clinicians are asking. And so, relax, try to figure out what we're trying to ask, and help your partner out. And we try to make this a discussion. We want this to be an educational experience for everyone that is present at rounds. In addition to the educational component, and acting is basically another learning opportunity about the specific diseases, this is also a time when we're trying to actually learn about the cases. We want the updates on, how is the animal doing today? What's the TPR? Has things changed? Because certainly that is important for the management of the case. And you have that information because you're the ones that did the physical exams on those animals that morning. And so realize that we're doing this for a reason, and we rounds are a very important way in the time that we convey that information. During the course of the rotation, you will be asked to give a student seminar, and this is on really any food animal related topic. The way that you do it, most traditional way, is a PowerPoint presentation, and we have the ability to do that in our learning conference room. It should be about 10 minutes in length, but the length is not super critical, but that's kind of 10 to 15 minutes is kind of the ideal range to shoot for. It should be fairly detailed on some food animal related topic. We would like to go a little bit more in detail than maybe what you've just learned about in your class notes. Do a little bit of research, do a literature review, try to figure out maybe some the more recent literature and information that's available on a specific topic. This should be a really good board review for the person, especially for the group that's preparing the presentation, and hopefully everybody else in the audience. In the last couple years, really kind of since COVID, we started doing group presentations. These used to be individual student presentations, and we've started doing group presentations. And I actually think that the group presentations have been better in general than the individual presentations. So certainly that is encouraged or permitted and even encouraged. But if you want to, if your group decides that you guys want to do individual presentations, that's perfectly fine as well. If you have questions about picking a topic, please feel free to ask us. We're more than happy to help you. Again, it should be fairly detailed on a given topic. Avoid topics that are too broad, like respiratory disease in cattle or calf diarrhea. It's just a topic that we could lecture on for multiple hours, and as a lot of you probably know already. And to get that into a 10-minute talk is really challenging. And so, something more like cryptosporidium in calves is probably a more appropriate topic. I mentioned before that you will be assigned a day or two that you're the receiver. So what does that mean? So back in the day, the receiver used to act as, the primary job was to act as a liaison between the front desk, the receiving desk, the reception desk, and the student body at large. They were a point person that the front desk, when a case would come in, that they would call and ask the receiver to come to the office. They would come, they would be the ones that would first kind of introduce themselves to the client, figure out what group was seeing a given case, introduce the client to the rest of the group. With the new medical record system, with the electronic medical record system, that job has largely been replaced by technology, where the clinicians and I think students on occasion, maybe hopefully maybe more than an occasion, get a electronic notification that cases arrived. And so that job has not been as important in the last year or so. However, it is nice to still have a person that the front desk could call potentially, and one person that knows who they are on a given day, if they call the receiver to the office, that the front desk could get a hold of. The receiver starts rounds at 9 a.m. every morning by officially and traditionally ringing the cowbell that is at the end of Ward 2. And so that is a very important job, because if you ring it, they will come. And everyone comes out of the woodwork when you ring the cowbell, as we know that rounds are starting. And at the end of rounds, the receiver will also read a list of cases that are coming in for that given day. And it is their job to make sure each of those cases that are scheduled to come in that day have a group that is assigned to them. And so that is the receiver's most important job, is making sure that those cases are assigned. You can ask for, as a receiver, you can ask for volunteers. Usually that's how it goes, but the receiver has all power to assign cases that to make it fair and equitable. Realize that what goes around comes around, so everybody will get an opportunity to be a receiver. So please be fair, and show collegiality during that process. And I've very seldom have ever seen it any other way. So it has been somewhat tradition before I was even a student here at Ohio State that the receiver brought breakfast every morning. That is certainly not a requirement. And I had a negative student comment here a few years ago that said it's unfair to make the receiver bring breakfast. And so I'm not making anybody bring breakfast in the morning. If you want to continue that tradition, you're more than welcome to do it, but certainly not a requirement. So talk a little bit about treatments and where to get meds, etc. Realize that no treatments should be administered or done without approval, without the knowledge of the clinician that's managing that case. Medications are stored in a few different places in the food animal ward. First of all, boxes, there are bins in stall 23 that are associated and tagged with each of the stall numbers in wards 1 and 2. And that is a good place to store medications that do not need refrigerated, especially if there are a lot of drugs, a lot of other potentially equipment too that's associated with the case. You can put them there for safekeeping. What I think most people do now, and this is perfectly fine as long as things do not look cluttered, is there baskets that will hang on the stall fronts. You may put medications in there as well, especially medications and things that you need frequently throughout the day for a given patient. And so that can be a place as well. If you have refrigerated drugs, there is a refrigerator in stall 23. Don't get that confused with the refrigerator that is in the technician office, because that is for human food. And you're welcome to put your human food, your lunches in there too, if you want to have that kept cool throughout the day. But that refrigerator is not for drugs. The drugs and other refrigerated items for a given patient should be kept in the refrigerator in stall 23. And we will talk to you and kind of show you in the first day of the rotation, sort of a quick overview tour of where all these things are as well. Students are responsible for the treatments on the weekdays between the hours of 8 and 4 p.m. So these are the hours that you're working in the hospital, right? And so the students, if you're there, you are responsible for doing the treatments on those cases that may require treatments throughout the day. On weekends, And or in emergency times or after hours, we have a team, the ICU, and we actually have a technician that works our evenings on weekdays. And then the large animal ICU will help you with treatments in those off hour times. You are responsible for, even on weekends, you are responsible for doing your 8 a.m. treatments and your 4 p.m. treatments. And so we do require that the group or the students, doesn't have to be both members of the group, but the students that are assigned to the case are responsible for doing treatments at 8 and 4, so those 2 times during the day. On weekdays, you are responsible for doing not only 8 and 4, but everything in between. Hopefully that makes sense. But on weekends, it's just those 8 and 4 treatments. There are ICU sheets, and we still use a paper sheet to indicate to ICU what treatments need to be done after hours. And the plan is to transition this to an electronic record, but that has not occurred yet. Please make sure these ICU sheets are filled out in detail, because the people doing the treatments do not know. You may take things for granted on your cases that you understand because you've worked with this case since it's come in. But realize the people that are doing the treatments don't have the familiarity with the case that you do. So you need to be very detailed as far as what medications need to be given, the route that these medications need to be given, the dose that it needs to be given, where the medications are kept, if they're kept in the cage on the stall front or the little basket on the stall front, or if they're in the refrigerator in stall 23. Be detailed. Also, make sure that the ICU sheet that you fill out matches the treatment sheet on the stall door. That ICU will check off that they've done those treatments. Because if they don't match, then there is a question in their mind, am I doing the right thing? And then usually the clinician or the student will get a call after hours saying, the treatment sheet says this and the ICU sheet says this. Which one is it? What do I follow? So make sure that they match. Make sure that you're very detailed with what you want them to do. Realize that this service is not free. I mean, the client gets charged for these after-hour treatments, and so try to minimize the use as much as possible. We certainly want to maximize patient care, and if it needs treatments throughout the night, that is what the service is there for. But we don't want to abuse our nighttime technicians. They are doing a great service for us so that we can go home and get a good night's sleep. And so realize we want to not abuse them. We want to respect what they have to do. And they don't just work for farm animal. They also do equine treatments as well. And so we have to be cognizant that they may have a lot of patients that they're taking care of overnight, and they may not be able to spend 5 hours trying to get a cria that won't nurse to take a bottle. With BID treatments, so twice a day treatments, we will ask the students that are on the case to do the 8 a.m. and the 4 p.m. treatments. With 3 times a day treatments, at least 2 of those treatments should be done on the hours that you guys do treatment, so i.e. 8 a.m. and 4 p.m. Make sure the treatment sheets and the ICU sheets include the student name, the clinician name, and contact information so that they can get a hold of us if they need to do that. There are some records, some paper records that are kept on the stall front. Ideally, these should be kept behind the little plastic or the laminated sheet that you see here on this clipboard. That keeps these sheets cleaner. Frequently, we hose down the areas. Frequently, there's fly specks in things that will cover everything that is not adequately covered. Realize these are part of the medical record, so we want to keep them nice. Also, they have patient information on them that is part of a confidential medical record. And so ideally, they're behind something that someone that may be visiting another patient, someone from outside that's visiting another patient, can't just look and say, oh, who's that cow from? And because that is a breach of client confidentiality as well. And so we try to secure those records behind that cover sheet. Biosecurity, super important, not only to prevent diseases and spread from one animal to another, but zoonotic diseases as well. So don't be a fomite, wear PPE as appropriate, and disinfect as appropriate, and use common sense. Safety is also really, really important to us. If you're unfamiliar with working with large animals, with farm animals, please ask a technician or a clinician to give you a hand, especially with large bulls and aggressive cattle. We ask that at least 2 people be present at all times, ideally a clinician or a technician. If you're unsure how to use equipment, please ask, and be aware of your surroundings. And so as you get in with, or you're in working with an animal that has, a potential to turn and be aggressive or potential to hurt you, as really all large animals do, have an escape route. We have 2 types of housing in the farm animal world. One is box stalls that look like this, and the other are pipe stalls that look like this. I'm sorry, I don't have the zoomed out view for you on that. Our large animal patients, usually, so our cattle patients, we like to ideally put them in pipe stalls rather than box stalls. The reason being, and sorry, I wish I would have the zoomed out view on this, but there are more escape routes with the pipe stalls than the box stalls. Small people can actually fit through. Be surprised how you can squeeze through pipes, and there's a head catch on each of these, and you can potentially squeeze through that. You potentially can go over the top of the pipe stalls if you need to get out of the front. All stalls, including the box stalls, have escape doors in the back and have a window in the back, and so I'm just giving you potential escape routes, right? Box stalls, as you can imagine, there's no way, if this door is closed there, and especially if it somehow gets locked and you're in there with an animal, there is no way of escaping the front of the stall. There are ways of escaping the back of the stall, but it can be tough, especially if this window in the back of the stall is closed as well. And so our large patients, we try to put them in pipe stalls at all possible. However, one of the downfalls with most of the pipe stalls that are in our barn, and we are trying to replace these, we have one replaced, we're slowly replacing the other ones as they become available, is these latching mechanisms are not good. They're old. And it is tough to see sometimes that they're latched, and sometimes they break. And as you look at this gate right here, you may say, oh, it looks like this thing is latched. But the outside of the gate, which is right here, and I can't really tell on the bottom, but I actually think this gate is not latched, at least not latched all the way, because these other dogs, I call them dogs, these little clips, need to be pushed down adequately in the little space that they go down in. If that does not happen, then these gates are actually open. And it will look like, even if the outside ones are latched, it can look to you like the gate's latched, but the gate will actually push open, and the inside ones are the ones that are more important for making sure the gate doesn't push open. So they're hard to latch. My point is they're hard to latch. Sorry, I've spent too much time talking about that. And so the first thing you want to do when you latch it, shake the gate, rattle the gate, and make sure that it's actually closed. If we have an animal that's in there that we really, really would be not happy, and the rest of the hospital would not be happy if it was out wandering around, we usually will take a rope and we'll tie a rope around this gate as well, so that it will keep that gate secure if it's not latched, and if the animal just kind of accidentally bumps around or bumps into it, and it would have a tendency to open up. If it's not latched, hopefully the rope will keep it closed and the animal will feel like they're contained in there. The other thing that is important with with all of our stalls is there's a grate in the back, and you can see it back here behind that the gate. And that is where we push manure. Every day, the grooms will come in and clean the stalls, push manure down there, and make sure those grates are closed. If the stall's occupied, the grates need to be closed. We actually had a couple patients in my time here that escaped, small ruminant patients that escaped through the back of the stall. So make sure that that's closed. It's also possible that even a large animal could get its legs stuck in there and potentially break a leg. So those grates need to be closed. I mentioned the grooms. The grooms are super, super great and valuable to our service. They will clean the stalls every day, so we don't have to. Now, if you see manure that is accumulating, a stall that's dirty, it'd be nice if you kept it clean as well, because they only clean the stalls once a day. They also throw hay to all of the patients in the morning. Most of our patients, unless they're going to surgery, usually get free choice hay. And so if you notice that they don't have hay, please give them some hay. Talk to your clinician about the individual feeding of individual cases. But the grooms will do this for us. So that is really, really appreciated. But you guys are responsible for the rest of the management. So water, the feed, any grain, you guys are responsible for. Again, throughout the day, if they need anything else, you guys have the responsibility for that. If you have questions, please feel free to ask. We are here to help you with whatever. We do have blood donor animals. We have 2 blood donor cows. We also have blood donor sheep. We have blood donor goats and blood donor alpacas. They are relatively healthy animals, but they need to be watched. And so if you notice any problems with them, please let us know. We will also assign these to students for the routine maintenance, routine husbandry, if you will. So making sure they have clean water, making sure they have adequate hay, and just an extra set of eyes on them is important. If you have lactating dairy cows in the hospital, they do need to get milked, usually twice a day. As part of a routine physical exam, we will do a CMT and black plate testing for mastitis and ketones as part of that physical exam. So please remember to do that. If we do have animals with mastitis, we milk those last. Usually we don't have a lot of animals in the hospital that are getting milked at any one time. So typically that's not a problem, but again, please be aware of these responsibilities. And if you have questions, please ask a clinician. Please clean up after yourselves. And we do have, technicians and occasionally student help that are there to help us with some of these responsibilities as well. But realize if the technician is constantly cleaning up your messes, then that's less that they can help you put catheters in, and less that they can tech surgeries and do other things and helping restrain animals and getting animals off trailers. And so it is really important that we all pitch communication. Nobody's above this, and my doctors are great. My team is great, and frequently the clinicians, the faculty, and technicians will all help in this regard. But please do your part to make sure that we're keeping things clean, tidy, and more biosecure. I mentioned briefly about client communication, and want to overemphasize the importance of this because I think this is one of the most important things. And when I, as a section head, get complaints, usually it's due to lack of communication between either the students or the clinician on the case and the client. When we have these communications, please remember to document it. And there's a place in easyvet to document it. And hopefully you're familiar with the communication. I'm actually not a super great easyvet user, but this is a place that I've gotten familiar as I have tried to document my client communication. So there's a place to document all of that in easyvet. And this one patient, and just use it as an example, I pulled this into this presentation right before I am recording this. And this patient has been in the hospital for over a week. It actually had surgery a couple days ago. It's had a lot of stuff that we could and did adequately communicate, I think, to the client. But I just noticed today as I pulled this up, there is no communication documented in the easyvet record. And so if there would be an issue with client communication, and I need to, if the client complained about something that they weren't informed of, I have no record to go back and say, hey, you were actually told this, and this is what we said, and these were the potential complications, etc. So please make sure that we do a better job. And I am also need to do a better job at recording this and when this happens. But again, we all have access to this client communication tab, and we really should be documenting things. In case of emergency, of course, you all know, hopefully you know as adults now, to call 911. There is a panic button that is located in the technician office. I did not know what it was once and triggered it, and the police will respond. So just to make you aware that there is that one there. Try to be careful not to hit it with the chair. It's under the computer in the office because we've accidentally triggered it before too, where with the little rolly chairs in the office. Just some kind of final things. Please help your classmates. Teamwork is super important. Clean up after yourselves. Safety is important. If you're unfamiliar with equipment, unfamiliar with working with large animals, ask. We're more than happy to help you. Make sure your medical records are kept updated with communications and the rest of the stuff. Make sure those records are updated by 9 every day by rounds. So probably mean you need to get in by 8 in the morning most days, maybe earlier if there's a lot of cases and a lot of intensive cases in the hospital. You're going to get out of this rotation what you put into it. We want you to learn. So work hard, but have fun along the way. We like to have fun with you. And with that, I am done. And again, welcome to the Farm Animal Rotation. I hope it's a great rotation for you. I'll talk to you later.